We have an exciting program for you today. So if you have about 5 or 10 minutes, you'll want to stay right here. Again, this is Let's Talk NCLEX. You guys know I'm your host for today. I'm your host for every event that we have here at REMAR Review. My name is Regina MSN. I am a nurse educator who loves to transfer my expert knowledge about the NCLEX right to you in your home, in your study time, just to make sure that when you sit down and take NCLEX, you are prepared for the exam. Here at REMAR Review, we spend a great deal of time educating you guys and preparing free resources. We are the home of the free NCLEX review, of the free Let's Talk NCLEX, of the free Let's Talk Nursing. If you guys need it, we have it in terms of what you want to know for the NCLEX exam. And you know what the thing about Let's Talk NCLEX is that I am able to bring you new and fresh information about this exam. You don't have to wait every 3 years when it comes to us, because every week I get on here and I bring you hot topics from NCLEX, from new nursing research, and it's just a beautiful thing. So I'm so glad you're here. When you get off of this broadcast, make sure you head over to the website so you can connect with us. Our website is remarreview.com. There you will find your NCLEX reviews, inspiration, motivation, but mostly the resources that people are using to pass their exam. And I love to start every Let's Talk NCLEX with an amazing testimonial from a student. And you know what? I'm just going to spend a little bit of time on this particular student. Hi, everybody. How are you guys? It's Friday, so I'm glad that you're here for your assigned required group. But our REMAR nurse of this week, man, Elizabeth. Nurse Elizabeth Adeyemi, she is such a wonderful testimonial to spotlight, because if you look at the picture, you can see like she's super happy now and she's smiling, but she has an amazing journey. And so I spent some time after she sent her video testimonial just watching it and replaying it. But essentially, if I can wrap up her story really quickly, she graduated in 2013. So she graduated in 2013, and she had actually taken her NCLEX exam 7 times without success. And she said, you know, when she tried everything, she literally tried everything. And when she took it the 7th time, she was so down. That's the only way I can explain it. If you watch her video, she felt so defeated. She didn't want to do nursing. Like, she just really felt so bad, to the point of, she says in her video that she actually enrolled to go back to school for another career. So she had totally given up on her registered nursing license. She was going back to school to be an occupational therapist assistant. And her program was actually supposed to start in January of 2018. But for some reason, she just could not find it in herself to go to her program. Like, it was something that prevented her from starting the program. And of course, you guys know, we know that's God. Like, God did not let her open that door because she was going to go down the wrong path. She could not stop because she had nursing in her heart. And some of you guys who watch the testimonials and you watch me every week, you know that you long to be a nurse. You know that you belong in the field of nursing. And so it's just constantly tugging at you. So Elizabeth was in the same situation. She was frustrated because she couldn't pass her NCLEX exam, but she also knew she did not want to really be an occupational therapist. She really wanted to be a nurse. So she got online and she looked at NCLEX reviews that she had never heard of, and she found REMAR Review. And she said, I'm going to give myself another opportunity with the REMAR Review. And so preparing for her exam for her 8th time, she said she brought the self-study DVD package and she did the 6-week calendar. And when she was finished with our 6-week calendar, she said she took a couple more weeks to go back over the program. So she actually did it 3 times. She did the program 3 times. She made sure she knew every book inside and out. And then she was getting ready to test, and she said she was still a little anxious. So you know what she did? She went to our YouTube channel and she did Faith Over Fear, which is a free resource that we have. And she also did my anxiety workshop. And those 2 things really helped her. See, Remar Review, we make sure all your bases are covered. No excuses. So we gave her the content. She said, well, I'm dealing with a little fear. Okay, we addressed the fear from a biblical, spiritual background. She said, oh, I still have a little anxiety. Handled. We did the anxiety workshop. So when Elizabeth sat down for her 8th time, she said she was just covering her exam in prayer. Like she just prayed about it. She prayed for, what she actually prayed for was endurance during the exam. She prayed that during the exam, her mind would not fail her. She would not get tired. She would not give out before the final round. And she had 231 questions. 231 questions before her exam shut off. And she is so proud to say, to God be the glory, that on her 8th time, she passed her NCLEX RN. And when I looked up today about the number 8, the significance about the number 8 biblically is it is the number of the resurrection. So something that was dead is able to have new life, representation, with the number 8. And that just speaks so much. It was the 8th time she took her exam in the year 2018 in the 8th month of the year. So congratulations to Nurse Elizabeth. You have a new life with your license. And I'm really humbled, and I'm really, I'm just really happy for you. And I'm so grateful that you shared your journey with us all, and you were transparent about the process, because I'm telling you, it's a powerful thing when you understand that it does not occur in your time, but in God's time, it all is beautiful and it all works out. So congratulations to, again, Nurse Elizabeth. Yes. And I see you, Samantha. I see you saying that you passed your boards as well. Listen, I need the video testimonials. I really need to. So you say pass your exam. I wrote one thing on the board. Yes, I will, I must pass NCLEX. First time in 75 questions, and it happened that way. Yes, thank you. Yes, that is what I'm talking about. I love the inspirations, the motivation. You guys got me wanting to do that, writing things all over, like just to inspire and encourage myself. I had to take some time out to spotlight the wonderful things that are happening here at Remar Review. But again, I really get 2 questions, 2 of the most common questions that I've been getting lately. Number 1 is, Regina, can you take NCLEX for me? And I laugh at the question because I really wish that I could. I really, really do. If I wouldn't be faced with jail time and persecution, probably, but I get that. But another question that I get very frequently is, Regina, can you be my private tutor? Can you just tutor me? Can I talk to you every day? And that is another one of those questions that it touches my heart, because I know that you guys look to me for encouragement and information, but I'm also happy to be able to point you to a resource to say, no, it's probably not the best thing for me to tutor you every day, but I do have something that I 100% am confident in that will allow you to step up your knowledge game to where I would have you to be. And that is, it's just the DVD package. It's like having me in your life every day, whenever you want, for however long that you want. And it is just it's just the resource really that bridges the gap between what a graduate nurse knows and what a nurse prepared for NCLEX knows. So I say this with 100% confidence. I love that DVD package. It is literally me in your home with you every day. And so when people, they say things that I say, they say they hear my voice when they're testing, that is a result of them really spending that much time with me through that package. So again, congratulations. I see, Valessa, you passed today. You found out you passed. Monica, you did too. I can't keep up with it. I can't keep up with the testimonials that you guys are sharing on here. I'm serious. I want to shout out to everybody. I hope you guys are reading these comments. I hope you guys are reading these comments and the motivation that comes along with it. Claim it. If you want to be a part of the people who are passing, you have to first identify yourself as one who is able to pass the exam. Call it out. Just say, I like how I see it. I'm next. Yes, you're next. But send in those video testimonials. It's easy. Post them to our Facebook wall, email them to us. Tell us your story. We'd love to spotlight you. You are a testimony. You get your REMARNURSE shirt. You know, I spotlight you in front of thousands. You see how many Facebook friends we have. So you get your shout out in front of thousands and thousands of people. But most importantly, you get to tell your story and you get to motivate someone who's coming from behind you. And that's what we do here as a family. It's our expectation that we give back. It's so much more than you just passing the exam. Like, it's so much more than you just passing the exam here. We want you to be successful and whole in all areas of your life. And so we work really hard to make that happen here at REMARNURSE Review. All right. So yes, next to pass NCLEX, let's go on with what we came here for. We have the motivation. Now it's time to study. So right now we're going to go over our NCLEX question of this week, which was a very good one. I like to pat myself on the back for this one because the answers were all over the place. So it just tells me that we need to review. So here's the question. A charge nurse is managing a group of hospital staff. Which of the following actions indicates a need for further instruction? I got a lot of questions about, hey, Regina, what does further instruction, additional teaching questions, what do they look like? How do I think about them? So this is a scenario. You're put in the position of a charge nurse. Which action needs to be corrected? So here are the choices. Number one is, I'll do it. Number one is a registered nurse who pronounces a client dead. 2, a nurse's aide who takes an apical pulse on a client with congestive heart failure. 3, a nurse's aide who is reporting malfunctioning equipment. 4, a licensed practical nurse who has documented follow-up teaching in a client's chart. So again, we're looking for which action needs further instructions. Here are our choices. We have a registered nurse who pronounces a client dead. Is that inappropriate or not? 2, you have a nurse's aide who takes an apical pulse on a client with congestive heart failure. Is that okay? 3, you have a nurse's aide who is taking the liberty of reporting malfunctioning equipment. I see the answers coming in. They're all different. 4, you have a licensed practical nurse who has documented follow-up teaching in a client's chart. So these questions right now, additional teaching, further instruction, these questions are very popular for NCLEX because what they have you to do is not only identify your scope of practice, but others around you. And because so much of the NCLEX exam is that management of care, coordinated care, you have to be able to demonstrate that you understand what's safe for not only yourself, but those who you might be delegating assignments or patients to. So the correct answer is going to be, number 2, a nurse's aide who takes an apical pulse on a client with congestive heart failure is inappropriate, as nurses' aides are not trained to do this type of assessment. So I know the questions are about to start coming, but if you think about what your nurse's aide is allowed to do when it comes to vital signs, their vital sign collection is very simple and very basic. So we would expect them to do a radial pulse, basic blood pressure, temperature, and counting respirations, which is something that always, as a nurse for me, I always took my own vital signs, irregardless of who was responsible for collecting them. But we would not have the nurse's aide with the stethoscope finding an apical pulse and giving you that result. So that is an action that would require additional instruction and additional teaching to that specific staff member. I hope that makes sense to you. I hope that really makes sense to you. Let me further show you my notes here. So my notes for this as well. We looked at one of the options was a registered nurse pronouncing a client dead. Well, pronouncement of death is legal by a registered nurse. There is a difference between a pronouncement of death and a certification. They are not the same. So I'll just read here what I got from the law here. It says pronouncement of death by a registered professional nurse. The determination made after an assessment that there is an absence of human responses, spontaneous breathing, and heartbeat is authorized for a registered professional nurse. So nurses, based on our assessment skills, are able to say, this person is no longer with us. This person has no vital signs. There's no breathing. This person is gone. Okay. So this is legal for a registered nurse. Now, a certification of death is something that the physician would be responsible for. So the certification of death is actually, it has to do with the actual death certificate. So it is identifying the patient as dead and also the cause of death. Now that is where we as registered nurses would not be able to do. So that is what needs to be dated and signed by the physician last in attendance of the deceased. Okay, so this is the law. This is the law here. And I knew that it would be kind of tricky, but I'm glad for you guys who did get it. And I'm glad for you all that are here that are learning. Now on my notes here, it says some of you guys had some questions about the LPN being able to document follow-up teaching. That was also one of the choices that people picked that or they thought was incorrect. But LPNs, they do reinforcement teaching and follow-up teaching. So that is why I tell my PNs, do not go into the exam thinking that there are parts of medication or diseases that you don't have to know. You have to be very well-rounded, whether you're taking NCLEX RN or NCLEX PN. I choose to prepare anybody taking the NCLEX PN exam like they're taking the NCLEX RN exam. I don't leave out certain principles just because you're a PN, because you do reinforcement teaching and follow-up teaching. So as a PN, you have to document that kind of teaching was done, or you didn't do it. You guys know if you don't document it, you didn't do it. So very good. It was a tough one, but I know you guys will not forget that question. I love Let's Talk NCLEX because it gives me an opportunity every week to see what you guys know, see where you're at, and it helps me to, improve my NCLEX review, improve our event study sessions, things like that, because I know what you guys know and what you don't know. Okay, so as is our custom, we had an NCLEX question, we went over the answer, but there's more. There's always more. So So if you miss the answer, you have to watch it. You have to watch it later. You have to go back because we are moving on. So actually, this question was on the Remar Review Instagram page. So I do questions there. Shame on you guys if you're not following me on Instagram, because that is a place where I also like to educate, but I also like to put up pictures of myself and my family and things that are happening. So check out my Instagram page. It is, I think it's fire. But this was the question that was on here. If you like these kind of questions, find me on Instagram, Remar for NCLEX. Here's the question right now. All right. Look at this. Look. What is the most likely diagnosis in this patient with hypothermia and bradycardia? 1, Cushing syndrome. 2, generalized lipodystrophy. 3, hypothyroidism. 4, superior vena cava syndrome. Look at the patient, and this is basically a level 1 NCLEX question because you're making an assessment based on clinical signs. All right, so we have a patient here. You can look at them and then also add hypothermia and bradycardia. All my Remar nurses, what are you thinking this patient has? I see 2 different types of answers. I see number 1 and I see number 3. If we were on Instagram, you'd be able to swipe for the answer, but we're gonna do it the old-fashioned way. I'm gonna manually do it. All right, the answers are coming in. This is a level 1 NCLEX question. The correct answer for you guys is going to be, this is hypothyroidism. Congratulations to everybody who picked number 3. This is hypothyroidism. Let me read the rationale here. The edema of the face, coarse skin, and thin hair in a patient with bradycardia and hypothermia are common signs of severe hypothyroidism. This actually can be recuperated from if the patient receives the appropriate thyroid replacement hormone. Okay, so I know it's a basic. Hey, it's basic. These kind of questions are the kind of questions that get us, because we get real deep right when we are taking NCLEX exam, and they want to know, like, do you know the minimal competency of nursing education? And you guys do. So I think we have to do a better job as nurse educators preparing our students for this exam. So it's just a day-by-day process. We have to get on the grind every day and do it. So it's okay if you didn't get this one right. You've got to know your content. It's okay. How about we do another one? Okay, how about we do another one? This is another level 1 question. So let's see if you get it right. All right, so here it is. A 10-year-old girl presents to the emergency with an oral lesion. There is no trauma noted. Which of the following is true about this condition? Okay. Number 1, this is an infectious cyst of the submandibular gland. 2, this is a retention cyst of the sublingual gland. 3, this is an epidermoid cyst. Or 4, this is a bulbous cyst of the palate. What say ye all? What say ye all here? I know everybody's like, Regina, where'd you get this question from? This is the question. This is the Let's Talk NCLEX question for this week. So listen, a child comes in, they have this thing, this lesion in their mouth. What do you know is true about this lesion? What do you know? And I'm telling you guys, this is a level 1 question. I want to see all right answers. I want to see all the right answers. I'm giving you time to put in. Marie, Ingrid, you guys are regulars in here. I want you to get it right. Okay? I see some discrepancies. Has anybody ever seen an NCLEX question like this for real? Have you ever seen an NCLEX question like this before? You got to share this video. There's somebody that you know that needs to go over these questions with me on this Friday. To start our weekend off right, we have to go out with NCLEX style questions, okay? Yeah, if you want to change your answer, go ahead and change it. This is a level 1 NCLEX question. All right, so the correct answer is going to be, yes, number 2. Number 2, this is a retention cyst of the sublingual gland. And let me tell you something about this question. This question was not about the cyst at all. It was not about the lesion at all. What kind of question was this? This was a basic anatomy question. That's all it is. You didn't have to know anything about a retention cyst, a bulbous cyst, an infectious cyst. You didn't have to know about that. All you needed to know was anatomical location. That's it. And that is basic anatomy. We can look at this picture and I might not know what anything is, but I do know that this is the sublingual area, right? This is the sublingual under the tongue area. So this is the one I'm going to go with. Epidermoid, that sounds like the skin, right? The palate, where's the palate at? That's the roof of the mouth. Right? And the submandibular gland, that's like around the jaw area. That's not where we are. This cyst is very, very clearly in the sublingual area. So there is no reason why you couldn't get this one. And that's what that's why I say, I get emails where students, they'll say, you know, Regina, I saw a disease that I never heard of. It was, it was confusing to me. I didn't know what to do. And it's just like 9 times out of 10, you did not fail because of one disease that you were unfamiliar with. Like, just to be honest, you're not going to fail the exam because you don't know one little medication or one disease, but you will fail if you don't know these large concepts like anatomy, like interpreting clinical signs. Like, these are the things that cause you to really fall below the passing standard, because it's just basic demonstration of common nursing knowledge. So, if you looked at the last question, you didn't get it right, you have to do a review. You just have to do one. And it's a process. It's a process. You can't light speed through it. It is daily studying, coming here, and well, I'll help you. I'll help you the best I can. But right now I have to move on to our next question. Okay. This is a level 2 NCLEX question. All right. This is a level 2 NCLEX question. Which group of clients needs special monitoring by the nurse while receiving furosemide therapy? So this is a pharmacology question. All right. So this is level 2 because you have to understand furosemide very well. And then we're also going to look at a special group of clients. So we have to understand their needs. So here we go. We're looking for the client that needs special monitoring while on Lasix. Here are the clients. Number 1, clients with MS. 2, clients with diabetes mellitus. 3, clients with stage 3 wound ulcers. 4, clients with increased leukocytes. So who are we worried about taking Lasix? Who are we worried about taking furosemide? Who's that going to be? What does furosemide do? What is it? What kind of, this is how you break NCLEX questions down. What does it do? Think about the labs. Think about the adverse effects, the side effects of the medication. Who are you going to be worried about? Here? Basic NCLEX question. Which group of clients need special monitoring by the nurse while receiving furosemide therapy? I see a lot of the right answers. Very, very good. The answer is going to be number 2, the clients with diabetes mellitus. And that is because furosemide can actually increase blood glucose levels. Did you know that about the medication? Did you know that? Is that why some of you guys, it's probably why a lot of you did pick the patient with diabetes mellitus, because when you have a diabetic patient, you have to be aware of what you're giving them. So, and nurses really are really great to protect their patients from this, because a lot of interns, like new baby doctors, they'll write orders for patients and they won't really be thinking about the patient. So like, I know I used to have patients who were type 2 diabetics, and they would come in and they would need hydration. And guess what the doctor would order? He would order D5.5 normal saline. You know, yeah, he would order IV fluids with dextrose in them. So I'm looking at this order and I say to myself, like every nurse does, okay, if I give this diabetic patient dextrose water, then what's going to happen? I'm going to be checking their blood sugars. I'm going to be trying to cover, high blood sugars every hour. It's going to be insane. So as nurses, we have to be able to call our doctor and say, hey, doctor, I just got your orders and I just wanted to make sure that I'm going to be giving our diabetic patient dextrose around the clock. Oh, you didn't know? Yeah, they're diabetic. So you have to be able to have those conversations with the doctors and do it in a way that everybody feels comfortable. And that's something you guys will learn. So basic information here today. But if you found yourself struggling with it, take it as a sign that you have a weakness in this area and you want to just make sure that before you test, you go back over this particular topic, furosemide and diabetics, anatomy, if that was your struggle today, or the legal responsibilities of registered nurses and licensed practical nurses. Easy. These are easy things that we can fix when we're trying to prepare for our NCLEX exam. All right. And this is what we do every week at Let's Talk NCLEX. We get it together. So just on today, Samantha passed her NCLEX exam. Valessa, okay, so Samantha's an RN, passed in 75. Valessa, you passed in 75 today. Monica passed in 75. And Mary passed in 75. Mary's a 2011 graduate. Hashtag never give up. So this is the culmination of Let's Talk NCLEX for this week. Thank you guys so much for studying with me. Whew, we did a lot today. It was a quick one, but it was powerful because of all the stuff we learned. I want to leave you guys with this, and it is just simply that you can conquer the NCLEX exam. I'm telling you, like, it is a process. I have the picture of the mountain here, and it was posted on the Facebook page, but literally getting over this exam, too many of you feels like climbing up a mountain. Is that what, can anybody agree or just put hearts? Like, it literally seems like you're climbing up a huge hill. But by doing it, by really going through the challenge of this exam, you are in the process of changing and transforming yourselves. And I don't want you guys to skip out on that process, because the change that you end up with is so much greater than what you have inside of you right now. Like, when you're finished with the process of studying for NCLEX, digging down deep, passing it, getting your license, it will literally be a whole new life. But in order to get there, you have to do things that you don't normally do. Like you have to, because if you do what you always do, then you'll be where you've always been. And that's just the truth about it. You have to make some sacrifices. One of my favorite motivational speakers, Eric Thomas, he says, if you want a new life, you have to sacrifice the old one. So in the old life, I don't know, you didn't really study, you didn't take your exam serious, you slept when you were supposed to be studying, like all the old habits that you need to get rid of, you have to sacrifice them in order to move forward. So let it go. Let the past go. Know that you can change. It's difficult, but it is not impossible. So conquer the NCLEX exam. Conquer the exam. Enter your new life. That's it. And so the first step for you to do that, I don't know, it might be just going to the website. Some of you guys might just need to revisit the website, remarreview.com, and start there. You can get the YouTube, you can get the free trial, you can get the boot camp, all these things you can do today to get yourself on track. And then start the 6-week process. Start the 6-week process, okay? Get back up. Don't, listen, even if you've had failure in the past, don't stay there. You don't have to stay down because you failed. You can get back up. You make the decision to try again. So it starts with the decision. So today is the day to make that decision. All right. So everybody have a great weekend. You guys know you can call us. The number is 855-NCLEX now. Also, email support@remarreview.com. We'll help you find the right products, connect you to the right resources, answer your questions, share your wonderful testimonies. I get a lot of testimonial videos through email now. So whatever have you, we're here. Our class motto, let's say it together before we leave. We can, we will, we must pass NCLEX. You guys said again like you mean it. We can, we will, we must pass NCLEX. That is our hope for you, if that is your hope for yourself. Thank you guys so much. Have a wonderful weekend. See you guys later. I love you all. Be safe this weekend. Bye.